Diabetes insipidus. What is diabetes insipidus? I'm Dr. Nadeem Sajjad Raja. DI or diabetes insipidus, also called as water diabetes, is an uncommon condition marked by increased thirst and urination and fluid in body become imbalanced. It affects 1 in 25,000 people. It is not to be confused with more common type of diabetes mellitus, though they sound similar, but treatment is available that can ease its symptoms. That includes relieving thirst, lowering the amount of urine the body makes, and preventing dehydration. 4 underlying conditions can lead to DI. Central DI is the most common type and is caused by destruction of part of the pituitary gland that produces vasopressin, which regulates body balance and urine output from the kidneys. In infants and children, this is often an inherited condition. Other causes include tumors, infections, head injury. Nephrogenic DI occurs when the pituitary produces enough vasopressin, but the kidneys fail to recognize it because of an inherited or acquired kidney disease. Maintaining proper water balance by drinking enough fluid is critical for children with DI, as they tend to lose a lot of water with frequent urination, which can lead to life-threatening dehydration. However, drinking too much water is also dangerous, as it may lead to a rare condition called water intoxication. What are the symptoms? Being very thirsty, often with the preference for cold water, making large amounts of pale urine, getting up to urinate and drink often during nighttime, fatigue due to frequent nighttime urination and interrupted sleep. Sign and symptoms in children: large amount of pale urine that result in heavy, wet diapers, bedwetting, being very thirsty, preference for drinking water and cold liquids, weight loss, poor growth, vomiting, irritability, fever, constipation, headache, problems in sleeping, vision problems. How doctors diagnose? So doctor will do physical examination. Urine analysis is done to see if urine is too diluted. Blood test to check sodium, potassium levels. Water deprivation test that involves not drinking any liquid for several hours. A healthcare professional will measure how much urine you pass, check your weight, monitor changes in your blood and urine. MRI, stimulation test. For treatment, consult your local expert doctor. Eating, diet, nutrition does not affect diabetes insipidus. Thank you very much for watching this video.